welcome to the IHME Post-Bachelor Fellowship online information session. If you have your camera on, can you nod if you can hear me? Thank you. Okay, wonderful. My name is Sarah Dillard, and I am a Continuing Education Coordinator at IHME. Jorge, a second-year fellow, and Helena, a third-year fellow, are joining me today. They're experts in the program and will be happy to answer your questions at the end. Please use the chat function at the bottom of your screen to ask questions at that time. This information session is intended to provide interested candidates with an overview of IHME and the PBF program, along with an opportunity to hear from current post-bachelor fellows. Let's get started. The Institute for Health Metrics and Evaluation, IHME, is an independent research center identifying the best strategies to build a healthier world. IHME is located in Seattle, and we are a research institute at the University of Washington. Through our research, we strive to provide accurate and comprehensive information on population health while building a stronger foundation for strategic decision-making, while ultimately ensuring better health for people worldwide. Our research is organized around answering three critical questions. What are the world's major health problems? How well is society addressing these problems? How do we best dedicate resources to maximize health improvement? You can learn more about how we do this by exploring our website later. The work of IHME Fellows has the potential to affect the health of billions of people in the world through the analysis of data and the development of new tools and methods. The fellowship is a unique professional and learning opportunity in a city at the hub of population health and big data. Fellows grow and develop as professionals by applying their knowledge and passion for health, technology, and data to advance health around the world. PBFs creatively solve complex problems in population health. As a PBF, you work collaboratively with a community of passionate researchers on small teams in a fast-paced and dynamic professional environment. This program starts each year in September. It's a 2 to 3 year program. It is a full-time professional position, and it includes the option to pursue a fully funded MPH degree. Importantly, this program incorporates close mentorship and advising from renowned, experienced researchers in global health. The program has 4 specific objectives: to strengthen individuals' quantitative skills to understand, develop, and apply sophisticated analytical methods. To nurture their ability to use technological and computational resources for maximizing research effectiveness and analysis of data. To cultivate fellows' capacity to perform high-level, independent, and rigorous research, and to improve understanding of the population health landscape. To achieve these objectives, the PBF program is arranged to best facilitate learning, growth, and development. The fellowship has 3 intersecting elements: 1, mentorship; 2, education and training; and 3, a professional position that provides opportunities for formal and informal learning, professional and personal development, and avenues for applying skills and knowledge. The PBF program is composed of formal and structured educational activities designed to facilitate an ongoing learning environment and intended to provide diverse learning opportunities that contribute to the acquisition of knowledge and skills. Education and training activities are the mechanisms which introduce fellows to the concepts, software, and methods that they can later apply to their research. This fellowship places you in a unique and dynamic professional setting where you have the opportunity to participate in empirical investigations of health in various capacities and engage with stakeholders from around the world. It is this participation in actual research that bolsters a PBF's understanding of the research process. So how one goes from a hypothesis or question to data collection to analysis and ultimately to publication. Being involved in research is an experiential learning opportunity where fellows can apply their skills and knowledge to tackle real-world health challenges. The PBF program includes a strong emphasis on mentorship. We define mentorship at IHME as providing continuous coaching and guidance to assist fellows' professional, personal, and career development, and to unlock their natural ability to perform, learn, and achieve. We view every interaction between any staff member and a PBF as an opportunity for mentorship and coaching. This is understood throughout the Institute. PBFs are assigned an advisor who oversees their work, but also provides professional, career, and personal development coaching. Advisors help fellows develop competencies for successful performance as a researcher and help to identify pathways for success after IHME. PBFs are eligible to pursue a fully funded Master in Public Health degree in Health Metrics and Evaluation through the University of Washington's Department of Global Health. The MPH degree curriculum is composed of a set of core requirements, track requirements, electives, a practicum, and a thesis. Coursework is highly interdisciplinary, and PBFs take courses from across campus with a concentration of resources from IHME. If fellows pursue the MPH degree, the PBF program is extended to a third additional year with graduation occurring at the end of that year. PBFs who apply to the MPH degree must seek admission through the Department of Global Health's MPH program and meet the University of Washington Graduate School criteria for admissions. Applicants to the PBF program are not required to apply to the MPH program simultaneously. There are a few additional elements of the program I want to mention. The first is that this is an immersive program. We see the PBF program as a residence program in global health, where fellows dedicate themselves to 2 to 3 years to working hard, learning a lot, and making a positive impact on the world. Given the immersive nature of the PBF program, we also see this program as an experiential learning opportunity. Fellows have opportunities to apply and test their skills and knowledge in a professional setting. Through mentorship and coaching, we help fellows reflect on their work and develop new understandings, connections, and talents. We also hope to cultivate a community of practice. The PBFs represent a group of individuals who share a common interest in population health and a passion to make the world a better place. The PBF program is collaborative by nature. There is a great deal of peer-to-peer mentorship and a fluid exchange of knowledge and skills within a cohort setting. In addition, we work to build a community of alumni who are continuously engaged in the field and continue to share knowledge and skills with younger PBFs. Lifelong learning. We also hope to instill a sense of curiosity and self-motivation in all of our fellows. We help PBFs understand how they learn and discover their own strategies for knowledge and skills acquisition. We believe that the PBF program prepares fellows to tackle challenges they may face in any new professional or academic setting. Through progressive on-the-job training, academic research, and training activities, coursework, field experience, and mentoring from a renowned group of professors and researchers, individuals can benefit from the PBF program at IHME in the following ways. Becoming an expert. Fellows develop expertise in a particular subject or topical area in health and also become authorities of a particular part of the world. Becoming a researcher. Fellows acquire the skills to conduct high-level independent and rigorous research. Through the PBF program, individuals develop the ability to define strategies for investigating a research question and using their creativity to develop innovative solutions to complex problems. Becoming an analyst. Fellows accrue a host of quantitative and methodological skills that can be applied to manipulate and manage data. Becoming a programmer. Fellows bolster their technical competencies to program and code in multiple statistical software programs. Becoming a professional. Fellows strengthen their professional experience and profile through skill building, publication, dynamic work experience, coursework, and an academic degree. Although PBFs may be new to the field of population health, they make significant contributions to both IHME and improving health overall. They're given the opportunity to work on and contribute to some of the most innovative and cutting-edge projects in the field. For instance, PBFs contribute to producing results and estimates which are used in our data visualization tools, like the one that you see right now. These tools are used by researchers, experts, policymakers, and other decision makers to better understand trends, patterns, and outcomes in health. Our data visualization tools were actually created by a PBF seeking to make their work more efficient. Now we have a whole team dedicated to building the visualization tools and a global audience who utilizes them. Another example is the Global Burden of Disease Study, which provides a tool for quantifying health loss from hundreds of diseases, injuries, and risk factors so that health systems can be improved and disparities can be eliminated. In Scientific American, Bill Gates discussed how he uses the GBD in his work through the Bill and Melinda Gates Foundation. He said, "So I've been taking GBD charts with me when I've met with people in Cambodia or Indonesia or even at the French Aid Agency about trends in Francophone Africa. They can reveal when we haven't set the right priorities. So it's a very important tool for me. Before I go into strategy meetings, I sometimes look at the GBD to remind myself of the numbers. A number of PBFs work on this project, analyzing data and producing estimates." There are 4 categories of work that PBFs usually go on to after IHME. Many enroll in medical school, many enroll in master's or other doctoral programs, many work in the United States in a health-related field, and many work abroad in health or a related field. The basic requirements of the PBF program are a bachelor's degree and no previous graduate training, strong quantitative and analytical skills, interest in research and population health, and the ability to work in the United States for a minimum of 2 years. So, how do you apply to become a PBF? We require the following materials: a resume, a goal statement, which is 500 words maximum, about how your skills, experience, and long-term career goals contribute to your candidacy, a personal statement, also 500-word maximum, in response to one of 3 prompts that will be provided in the application, a letter of recommendation, best if the letter of recommendation is from a professor or professional familiar with your coursework or research. It can be either someone who doesn't teach or it can be your professor. It's really up to you. An official academic transcript, which can be unofficial at the time of the application, as you'll see when you go through the application itself, and the application form itself, which is available through our website. The application review timeline is as follows. The deadline is January 10th, so you still have quite a while to apply. The applications will be reviewed in early February, and interviews will be scheduled throughout that month and will occur in early March. And final awards will be announced in early April, and decisions will be made at that time. Thank you. This concludes the presentation portion of the information setting. We would like to open up the session for your questions. Jorge, Helena, and I are here to answer any questions you may have. In case you joined late, my name is Sarah Dillard, and I am an education coordinator at IHME. You can use the chat function at the bottom of Zoom to ask your questions. But I will start by turning on our video and then by asking Helena and Jorge a question each. Hi. I'm Sarah, this is Jorge, and this is Helena. I'm sorry that we're a little scrunched here. So first off, I'm going to ask Helena, what impact do you feel your work has had towards improving health?
So just to give a little bit of an introduction to what I do at IHME, I work on the Global Burden of Disease, which is IHME's flagship project. We quantify hundreds of diseases, conditions, and risk factors around the world to try to understand what are their impacts. I specifically focus on neonatal conditions, so diseases that can affect babies until their 28th day of life. In terms of the impact I think that my work has had as just part of the GBD team, we know that the information is being used by high-level decision makers. So for example, the world leaders have committed to the Sustainable Development Goals, which are the SDGs, which are a set of different indicators that set priorities for governments. And we know that Angela Merkel and Bill Gates himself and many others are actually looking at our numbers to try to understand what are the focus areas that they should be prioritizing for the next years. And just kind of on a smaller scale, specifically on my work, I've talked to a number of GBD collaborators. So these are people who work in the Ministry of Health in their own countries, and I've sat in on meetings with them where they've discussed our estimates compared to what their data is. And they've said, oh, now I understand how to look at our data in a different way. I can see what I need to focus on in my own country. And I felt that was a really instructional view for me to see how that they were really interested in our results and would immediately implement solutions that we discussed together.
Awesome, thank you. And Jorge, what is the most important thing you have learned at IHME so far?
Yeah, really good question, Sarah. But to begin with, I would also provide a brief background on what I work on as well. I also work on a global burden of disease project, which is this large enterprise that attempts to measure and quantify health. And in that project, I work on estimating the burden of tuberculosis for every country and year. But now on to the question, what's the most important thing I've learned during the fellowship so far? I think it has to be never be afraid to fail. As a fellow, we have tons of responsibilities and tons of projects to work on, and that's on top of classwork. So we're going to class every day as well. So given all that, all these things going on, it's important to just do your best and ask for help from the researchers who are in this institute, who are some of the best scientists in the world. And if you do all those things, you always have good outcomes in the end.
Mm-hmm. I agree. That's great advice. Okay, I'm going to look at the chat. So we have a question here. What are 2 to 3 key characteristics of a strong applicant? Okay, that's a good question. So a little more background about the application review process. We are looking at everything, and it's a very comprehensive review. Lots of eyes will be on it, and we're looking at every piece that we ask for. So I think it's important to really spend a lot of time on your personal statement and your goal statement. And really, the strongest components of the application, I would say, is we want to know why you're passionate about population health and why you want to work here, what you think you would bring as a fellow. And then we also do want to see that you have strong preparation for quantitative research. So anything that you have that you can demonstrate that with, whether that's something on your transcript, or if that's something that you can incorporate into your goal or personal statement, that's really great. Okay. All right, another question. Are we required to know statistical software like R or Stata before coming into the PBF program? Is this needed to be a competitive applicant even if we have public or population health experience? It's a great thing to have. It's not required. Part of the PBF program is to provide training in those areas. So that's one of those education and training components that you'll be going through with the rest of the fellows. And so any prior coding experience that you might have is wonderful, and it will definitely help you out, but it's not something that you need to have. Again, I would say if you can show any other sort of, whether it's computational or quantitative skills in your background, and it sounds like you likely have some related to population or public health, go ahead and do that, and that's really great. You don't need to worry about trying to cram another class into your schedule or anything like that. Okay, another question. Is there a study abroad component to the program? So this, there's two parts to this question, I guess. There's a practicum experience, which is also called, I think we call it research abroad, or we have in the past. In the past, it has been abroad. It may not be in the future. The goal of it is that you will be placed in a low resource setting, and you will be working with people who work with IHME to do more direct field work. So it's basically an opportunity for you to kind of put into practice what you've been learning behind the scenes. And actually, I think Helena could speak a little bit more to that.
Sure. In September, I spent a month in Brazil, and I was working on a IHME collaboration with a number of other organizations to assess a program that was hoping to improve obesity and diabetes indicators among low resource populations. And so a lot of what the work was that we did was we worked with the analysts who were actually doing the data collection in Brazil, and we worked with them to understand how they were looking at their indicators, how IHME was viewing their indicators, and if there were any miscommunications between what we believed they were saying and what they believed they were saying. And so it was really instructional, because I think that we both learned a lot on both sides, both IHME and me as a fellow, but also the collaborators on the ground. So it was a good two-way exchange.
And to expand a little bit on what I said earlier about whether it's abroad or not, it is abroad for the most part, but I do want to clarify for any applicants that may not be able to travel abroad at this time, whether it's visa restrictions or something like that, there would be other arrangements that could be made. So don't let that deter you from applying to the program. You could be placed in a low resource setting in the United States. Okay. Lots of good questions. Thank you all. Okay, here's a couple questions from one person. The first one is how mentors and research projects are assigned or chosen. So those projects are assigned by myself and my colleagues. And during the first couple weeks of the PBF program, we have kind of an intensive training period, and during that time, fellows will complete a questionnaire that talks a little bit about what their interests are, what their strengths are at this current time, what they hope to build as far as their skills go, and who they think they would work well with. And so then we take all of those forms, we read through them, and then we think about what teams and assignments would be mutually beneficial based on those things, and then we assign the PBFs to those teams and supervisors. And assignments sometimes change year to year. Some PBFs are in the same team and have the same supervisors throughout. Many do not. And those changes are made in a kind of similar way, except we don't have a formal questionnaire every year. It's more just based on conversations that we've had and things that we've observed. And the second part of that question is, do any research or projects in the PBF program incorporate climate research collaborations with other UW departments? It's a good question. I don't know if either of you can help me out with that.
I know in the GBD, there was an effort to quantify the effect of temperature on different outcomes, different health outcomes. And so I think that they're still continuing to work on that risk factor. In terms of collaborations with other UW departments, I'm not aware of there being some sort of formal arrangement in that way, in the sense that a PBF is assigned to a non-IHME supervisor. But the UW environment is such that you can always reach out to other UW professors, and I know that I've reached out to non-IHME UW professors to ask questions about my research, and everyone is very welcoming. Do you have anything to add?
Yeah, to kind of jump on that, for what I work on, which is tuberculosis, we actually work really closely with other UW professors and who are in different departments. So it may also depend on what you're working on as well, if there is some collaboration there as well.
Thank you. All right, lots of good questions. Okay, what % of students in the PBF program complete a master's at the University of Washington? I'm not sure of the exact percentage, but I would say many people complete it and many people don't. I would say most PBFs definitely apply for it and sometimes make the decision later whether they're going to pursue the program because the application happens during your first year in the program. But it really can go either way. And I think it just depends on where someone wants to go after IHME, what their goals are, and then also how they're feeling about their workload. Okay, next question. Are international applicants currently working in the US on the H-1B visa eligible for this fellowship? You can apply as long as you can work in the United States for at least 2 years at the start of the program. And if you have further questions about that, our HR department would love to talk with you, and I'll make sure that I can connect you to them for more details. How long does an MPH degree take to complete after the fellowship program? Great question. To clarify, the MPH program, if you choose to pursue it, is completed as part of the program. So if you do not choose to complete the MPH, you are a fellow for 2 years. If you choose to complete it, you can be a fellow for 3 years, in which case you would be taking coursework to count towards that degree as soon as you arrive at IHME, even before you are admitted to the department later that year. You would just transfer those credits into the degree. So it would take you a full 3 years in order to complete it.
So just to add a little context,
yeah, please.
Essentially that means you take about 2 to 3 classes per quarter. The UW is on the quarter system. So I would say about 15 to 30% of my time is spent on class, and the rest is spent at the actual work of the fellowship.
Okay. Oops, sorry. Is there a limit to the number of years post-bachelor that a person is eligible to apply for the PBF program? No, there's not. As long as you don't have any graduate training, then you're welcome to apply. Can you pursue this fellowship without a degree or extensive work in math or economics? Yes. Again, any quantitative experience that you have that you can demonstrate is great. You will want to include that on your application, but we have PBFs who've been English majors. We've had many PBFs that are anthropology majors. And then of course we do have a lot of PBFs who are computer science majors or math majors, but you definitely don't need to fall into those categories. Is there a prescribed curriculum for the coursework component of the fellowship, or do fellows choose the classes they take? So, good question. There's a set of core requirements that all Masters of Public Health students take. Then there's a series of courses that people in the health metrics track take as well. So those are requirements together. And then there's a series of electives that you would choose that complete the degree. I don't know if you want to add to that, or you, Jorge.
What Sarah said. So we have these core courses that we take, but also there's a lot of flexibility in the courses we can take. So for like electives, I've been taking, for example, a lot of statistics and math courses, but you can really choose anything that's quantitatively related in some way.
And I've had basically for your electives, as long as you have a conversation with your supervisor, they can be pretty flexible on what you can take for your electives. So I have taken quantitative electives, but I've also taken bioethics and other kind of more anthropology related electives as well. So there's an opportunity to round out your education that way.
Yes. If you are graduating in spring 2019, can you apply in this coming application round to start next September? Yes, definitely. I would say that's the majority of applicants that we have are people who are going to be graduating this spring or even summer. As long as you have that bachelor's degree before you start our program, then you're fine. and definitely encouraged to apply. And I think we're running up on time here. Just a second. Sorry about that. I'll answer one more question. I know there's a lot of good ones here, so I apologize. To what extent does this feel like a job, and to what extent does it feel like school? I'll pass this over to Helena and Jorge, because that's a great question.
Yeah, I can start with this one. Yeah, I think for the most part, it does feel like a job since we spend around like maybe 80% of the time here working. But however, it also may depend on the quarter. Like I remember during the winter quarter last year, I definitely felt like I was more in school compared to job. But I think for the most part, though, it feels more like a job.
Yeah, I would agree with that. But kind of adding on the perspective that as a fellow, you're always learning. And so to the extent that, is job just something you do and school is something where you learn, I think that every moment in my actual job as a fellow, I'm learning. And so in that way, feel like I'm in school. But in terms of, commuting to class and then actually participating in homework assignments and that kind of thing, it's more of a minimal part of my day.
Okay, I think we're going to have to end here. And so I'm going to put my email in the comment section so that you can follow up. And please, if I didn't get to your questions in the chat, feel free to send those to me. I would like to answer them. So I'm just going to write that right now. And my name is here as well. All right. Thank you so much. Have a good day.
Bye, everyone.
I look forward to seeing your applications.